Greetings and welcome to Ask Dr. Danett, where I answer one woman's wellness question from an Eastern medicine perspective. This week's Ask Dr. Danett is a special edition as it falls during Black Maternal Health Week, a topic that is very near and dear to my heart. I am what is considered to be a near miss, meaning I almost lost my life soon after childbirth. And because of that, this time of year falling so close to my birthday is always deeply meaningful to me. There isn't a birthday that passes where I'm not incredibly grateful to be here, to be a mother, and to have the opportunity to raise my child. And I take a moment of silence and give honor to the women who did not have that privilege. So in recognition of that, this week's Ask Dr. Danett goes a bit deeper. We often hear about maternal morbidity and the rates are devastating. Black women are 3 to 4 times more likely to die from pregnancy-related causes. But many experts note that maternal mortality is actually just the tip of the iceberg. In fact, for every woman who dies from maternal mortality, it's estimated that 20 to 30 more experience maternal morbidity, meaning the true scope of what women are living through is so much larger than what we often see. So this week's question is, what is maternal morbidity and why aren't we talking about it more, especially for Black women? Maternal morbidity is defined by the World Health Organization as any health condition attributed to pregnancy or childbirth that negatively impacts a woman's well-being or functioning. And while maternal morbidity is tracked, the full extent of maternal morbidity is still unknown. There is often this idea that after childbirth, a woman either recovers fully or there's a tragic outcome. But in reality, there's a wide spectrum in between. Many women continue to experience things like physical challenges, mental and emotional strain, and long-term impacts on their overall health and quality of life. And for many women, these effects don't just resolve in the weeks after childbirth. They can last for weeks, they can last for months, years, and in some cases have lifelong impacts on a woman's health. There are also different levels, including severe maternal morbidity, which can include life-threatening complications or what are called near-miss events like what I experienced. One concept that helped me understand my own experience is something called postnatal depletion, described by Dr. Oscar Saralak, which refers to what happens when the body becomes depleted after childbirth, especially when a woman does not receive adequate rest, nourishment, and/or support. In many parts of the world, for example in Asia, as well as in other traditional and indigenous cultures, there are structured periods of postpartum care, sometimes called a sitting month, where a mother is supported in rest and recovery. That level of care is built into the culture. Here in the United States, that is often not the case. And while there has been a beautiful resurgence of midwives and doulas, which has helped tremendously, there are still larger systemic factors, such as the structure of our healthcare system and the impacts of systemic racism that continue to contribute to these disparities. What I've seen both personally and in clinical practice is that maternal morbidity can have long-term effects, impacting physical health, mental well-being, and overall quality of life. And I believe one of the reasons it's not talked about, or some of the reasons it's not talked about more, is because it's complex, it's not always visible, and it often becomes normalized. Women may simply adjust to how they feel without realizing how much their health has been impacted or what is possible for them moving forward. For me, this has been a big part of my life's work. Supporting women, especially Black and brown women, in rebuilding their health, strengthening their bodies, and creating a foundation for longer, healthier lives. If you're interested in learning more about how to support maternal health, whether for yourself or someone you care about, my book, A Taste of Our Own Medicine, is available. The link is in the description below. And if you're looking for ongoing support in strengthening your health and vitality, I also offer an online program called Radiant Reset, where we work with Eastern medicine principles and lifestyle practices to support long-term wellness. If you have a question you would like answered in an upcoming Ask Dr. Danett, you can click the link in the description below. Even though this is a difficult and complex issue, there is meaningful work being done, and we each have a role to play in creating better outcomes. Thank you for what you do. Take good care, and until next time, love being a woman.